be transitioning, taking you to a live event right now for the first time in close to 90 days. It's expected that Joe Biden is going to be taking questions from the media after a statement. It's been close to 90 days. He hasn't talked in a press conference setting, so we will take that live right here on News Now, everyone, right now.
What I think we should be doing right now, and then be happy to take questions. For weeks, we've been seeing the warning signs. Numbers don't lie. Infection rates are now going up in more states than they're going down. More than 125,000 people in the United States have lost their lives, and those numbers and new infections continue to grow at an alarming rate. And once again, is confronting the simple fact that we won't be able to solve the economic crisis without a rigorous public health approach. They're not separable. Despite the administration's propaganda that their response should be a cause for celebration, despite President Trump's request that we should slow down testing because he thinks it makes him look bad, the COVID-19 is still here, and the daily threat to American health and prosperity is continuing. It didn't have to be this way. Month after month, as other leaders in other countries took the necessary steps to get the virus under control, Donald Trump failed us. Month after month, as many of us urged him to step up and do his job, he failed us. Just look at the record. In January, I, along with others, sounded the alarm that over the coronavirus outbreak. Trump told the country that COVID-19 is, quote, totally under control, and that everything will, quote, work out well. In February, I warned about the failure to get information that we needed from the Chinese government. What I said was the president should demand Xi produce the evidence. Demand it. Trump said, quote, we're in great shape. Reported China's president said it was, quote, doing very well. In March, I set forth a detailed plan for 500 federally funded testing sites across the country, as well as guaranteed emergency paid leave. Later that month, I called for a full and immediate use of the Defense Production Act, critical for delivery of supplies that were basically needed. Trump accused healthcare workers. How was his response? He accused health workers of stealing your masks. That's what he said. Healthcare workers are stealing the masks. That's why we don't have them. In April, I released a plan to secure the supply chain for personal protective equipment, surge nationwide testing through a pandemic testing board, and launch a nationwide health corps to focus on contact tracing. Trump's suggestions? Americans should inject disinfectants into their bodies. In May, I condemned the false choice between preserving public health and our economy. I urged the administration to focus on the basic public health measures like testing that would enable us to sustain our economic recovery. Trump's response? He pushed for reopening without regard to safety and called testing, quote, frankly, overrated. This month, I outlined a path to reopen our country safely and sustainably. It provided workers, small businesses, schools, state and local governments the tools, resources, and guidance that they would need. Trump's proposal? He set a cutoff date for federal funding of testing sites in several states and actually went to court to take away health care for 22 million people by trying to get rid of Obamacare. And now, Donald Trump is in retreat. Remember, back in March, when I called, and he called, we talked about the need to act like we were at war with the virus. He called himself a wartime president. Remember when he exhorted the nation to sacrifice together and, quote, in the face of this inevitable and invisible enemy. What happened? Now it's almost July, and it seems like our wartime president has surrendered, waved the white flag, and left the battlefield. Today we're facing a serious threat and we have to meet it. We have to meet it as one country. But the president gives no direction, and he pits us against one another. We can't continue like this, half recovering and half getting worse. We can't continue half wearing masks and half rejecting science. We can't continue half with a plan and half just hoping for the best. You know, we won't defeat this virus with a piecemeal approach, lifting restrictions prematurely, increasing the volatility of the crisis, raising the likelihood of needing to reimpose restrictions. You know, until our science catches up to reality, until we have better treatment for those who become infected and ultimately are safe, proven, widely available vaccines, we have to continue to do all we can as the people and the government to keep our fellow Americans safe and healthy. Today, I'm releasing a plan with the steps I believe Donald Trump should undertake immediately to build on the roadmap I released back in March that would have saved lives if it had been adopted. It's a plan to save lives in the months ahead. But once again, I encourage him to adopt this plan in its entirety. This is too important for politics. First, testing, testing, testing. More testing is not only how you find more cases of coronavirus, Mr. President. It's how you stop the coronavirus cases. Testing followed by rigorous contact tracing, quarantine, and isolation protocols for those who've been exposed. People aren't waiting in lines for miles and miles long in baking hot cars for drive-through nasal swabs for the fun of it. They're doing it so they can protect themselves, but even more importantly, they know when they have this mask on, they're protecting others. They're protecting others. We know we're not where we need to be in testing. There are still hospitals and nursing homes that don't have access to the tests they need. Testing is how we see what's happening in communities all across the country. It's our eyes on the ground. Without that testing, we're flying blind. That's why it's so important to have reliable access to testing everywhere. We need to increase federal support for testing. That includes doubling the number of drive-through testing sites and keep increasing them until there are no more lines. We should create a pandemic testing board to spearhead a nationwide campaign so every worker gets called back to their job, can have the confidence that they and their fellow workers are not infected. You know, experts agree that we need more contact tracers to track the path of this virus. Individual states like New York and California are already hiring and training thousands of tracers. But we need to do more, including hiring at least 100,000 federally funded workers to perform contact tracing and other public health tasks. And they should begin to be trained now. Second, every single frontline worker should have the personal protective equipment that they need to be safe. 5 months into this crisis, and our healthcare workers still are forced to scramble for their own supplies and have to reuse these masks shift after shift. Hundreds of healthcare workers have died from COVID-19, and tens of thousands have become infected. It should be zero on both counts for these healthcare workers if they had the right equipment. You know, how are we in this many months into this and still don't have what we need? That's why we have a Defense Production Act. You know, Mr. President, use your authority, Mr. President. Use it this week. Scale up the production of N95 masks. You know, the steps you've taken so far haven't gotten the job done, Mr. President. Fix the shortage of PPE for our healthcare workers before you tee off another round of gauze. We can't just look at where we are today. We're going to need these masks and gloves and face shields for the foreseeable future. and we need to be ready. We know more is coming. Thirdly, we should be laser focused on treatments and vaccines. We should be leading a coordinated global approach on the science, not disregarding experts while pushing dangerous and disproved drugs as if they're treatments. There's been some progress toward treatment and vaccines, but the administration hasn't been transparent about how they plan to manufacture enough doses to make sure there's equitable distribution to scale. I hope they're doing it now. I called for a while ago. They should be providing $250 million to have a plan now exactly how they're going to distribute this so every American has access when and if the vaccine's available. They may be doing it, but we have no transparency. Let us see, Mr. President. The White House should report weekly on this progress. We can't end up in the same scratchy and distribution problems that we had in testing. We need to make sure the customers aren't being gouged by new drug and therapies and prices when they're developed. We have to immediately restore our relationship with the World Health Organization for all its shortcomings and missteps around Covid-19. This is why WHO was created. It is essential to coordinating a global response during a pandemic. And the United States should be leading that response as we had in the past. Covid-19 will likely worsen at the outset of flu season this year. So we need to put in place measures now, to ensure the seasonal flu vaccine can be ready, available, and administered safely to those who need it under social distancing guidelines, especially for seniors. Fourthly, we need real plans, real guidelines with uniform nationwide standards to help us chart our economic reopening. Whatever we've been doing now is not working. The state-by-state approach will only produce confusion and slow any progress. You know, you all reported the CDC tried to clear guidelines about what stages of reopening should look like. The administration delayed and scaled back those plans. We need clear evidence-based steps that states can adopt now. Both the standard must be met in order to safely proceed with further openings and the reimposition of social distancing rules when cases begin to rise. You know, this is not rocket science. We need to support schools and child care programs so parents, if and when they can return to work, are confident that their children will be safe and cared for. You know, we should be holding and providing a sticker say safe for shoppers, a certification to stores that prove they're minimizing their customers' risk and exposure. We absolutely need a clear message from the very top of our federal government that everyone needs to wear a mask in public, period. Period. Wear a mask. It's not just about you. It's about your family. It's about your nation. It's about your neighbors. It's about your colleagues. It's about keeping other people safe. It helps you, yes, but it's about keeping other people safe. It's a simple measure. It is also one of the most effective ways we can do the right thing. It may be inconvenient, it may be uncomfortable, but it's the right thing to do as an American. Protect your coworkers and neighbors. And finally, we need to protect the populations most at risk, our seniors, our Black and brown populations, Native communities that are being hit the hardest, vulnerable populations with pre-existing conditions. Know that this continued growth in case numbers is causing a lot of fear and anxiety. People, especially older Americans and those with loved ones in nursing homes, I get calls all the time. They're simply scared. They're frightened. This isn't just taking a toll on their physical health. It's an emotional cost as well. We can't expect vulnerable populations to quarantine indefinitely without support. And I want them to know that their health and safety will be my responsibility if I'm your president. And I will not abandon you. You know, these are 5 fairly straightforward steps that are going to help defeat this pandemic. And if you suspect that a lot of these steps are the same sorts of things I was talking about in March when I released my first COVID-19 response, you'd be right. If it feels like you're hearing the experts talk about the same issues for months, you'd be right. These have always been the steps the government needed to put in place to meet the threat. Statewide lockdowns that so many Americans lived under for months were intended to buy us time to get our act together. Instead of using that time to prepare ourselves, Donald Trump squandered it. Now here we are, more than 3 months later. We're hardly better prepared than we were in March. Infections are on the rise. The threat of massive spikes that overwhelm the capacity of our healthcare system is on the horizon. Americans, anxious and out of work, are fearful for their lives and their livelihoods. Donald Trump is doing next to nothing about it. Mr. President, the crisis is real. The crisis is real. And it's surging, Mr. President. Your promises and predictions and wishful thinking pulled out of thin air are not only doing the country no good, but making them lose even more faith in their government. America knows this crisis isn't behind us, even if you don't. They see what's happening, even if you refuse to, Mr. President. They know we need a coordinated national plan. We need it now, even though you don't, Mr. President, and won't do it. You called yourself a cheerleader. We don't need a cheerleader, Mr. President. We need a president, Mr. President. A president who will level with the American people. A president who will tell us the unvarnished truth. A president who will take responsibility instead of always blaming others. The president will listen to the experts, follow the science, allow them to speak. The president will lead, be an example for the nation. Wear a mask, keep your distance, limit the size of crowds. Mr. President, this is not about you. It's about the health and well-being of the American public. American people don't make enormous sacrifices over the past 4 months so they could just waste their time, and you could waste all the efforts they have undertaken with your midnight rantings and tweets. They don't make these sacrifices. You could ignore the science and turn responsible steps like wearing masks into a political statement. And they certainly didn't do it, Mr. President, so you could wash your hands and walk away from this responsibility. Maybe there are times this nation needs a cheerleader. Now is not one of them. America needs a president. Whatever Trump does or does not do, we can't know today what the state of the COVID-19 pandemic will be next January. But I'm almost certain, I hope I turned out to be wrong, I'm almost certain it won't be over. And if I should have the honor of being elected president, on the day I'm sworn in, I'll get right to work implementing all aspects of the response that remain undone. I'll have more to say about my day one COVID-19 agenda in the weeks to come. But my response will begin well before I take the oath of office. It will start as soon as the election is decided. I'll be a president who respects scientists, who won't censor their ability to speak directly to the American people. I'll immediately reach out to Dr. Anthony Fauci to ask him to continue his incredible service to the country. And I'll have from day one, ready to go, the best medical experts and scientists to advise on our response. Maybe most importantly, I will listen to them and let them speak freely. And I'll work with the governors and mayors of both parties from every state, territory, and tribe. It's a simple proposition, folks. We're all in this together. We got to fight this together. We'll emerge from this stronger because we did it together. And I'm confident we can. May God bless you all, and may God protect our troops. I'm happy to take questions.